I graduated from medical school in 2008, and since then, I've done residency training twice in two separate countries, served in rural areas, and also pursued specialized training in nephrology. And for the past 5 years, I've been a full faculty member. Over these 16 years, my approach to patient care has completely evolved. And the lessons I've learned, both from my patients and my experience, have shaped not only how I practice medicine, but also how I connect with people. In this video, I want to share those lessons with you, the hard earned insight and the truths about providing exceptional care that no one tells you when you first start out as a doctor. Number one, learn to ask the right questions. One of the first things you learn in medical school is how to take a medical history, because the answers you get are only as good as the questions you ask. And sure, asking about symptoms and medications is essential, but what about the other stuff? What's happening in your life? Are they stressed at work? Is there something going on in your family? I've had patients come in with high blood sugar that turn out to be stress from a divorce or a job loss. Asking questions that go beyond the medical chart not only gives you better insight, but also makes the patient feel heard and valued. And let's be honest, most people just want someone to really listen to them. Number two, listening is the best diagnostic tool. One of the most powerful tools you have as a doctor is simply listening. When you give patients the space to talk without interruptions, they often provide the most crucial details about their condition. Sometimes the answer you're looking for isn't in the labs or in the imaging, it's in the story they are telling you. For example, a patient casually mentioning something like feeling lightheaded after certain meals could be the clue you need to diagnose an underlying issue. But if you're rushing or cutting them off, you might just miss it. And so listening isn't just about gathering information, it's about showing patients that you value what they have to say. And when patients feel heard, they're more likely to trust you, follow your advice, and work with you toward better outcomes. Number three, meet them where they are. Not every patient walks into your office or clinic ready to make a big change. Some are already proactive about their health. They exercise regularly, they eat well, they show up to appointments on time. And others haven't seen a doctor in decades and may still be struggling with habits that are hard to break. So it's unrealistic to expect someone to completely overhaul their lifestyle overnight. What you can do is meet them where they are and be patient with their journey. Change takes time, and often people need reminders more than they need new knowledge. So start with small, realistic goal that they can manage. For example, instead of asking a patient to immediately adopt a strict low sodium diet, begin by encouraging them to reduce their salt intake gradually, like cutting back on processed food or avoiding adding extra salt at the table. And these small, manageable steps build trust and help them feel like they're making progress without being overwhelmed. The key is to support them and not to push them faster than they are ready to go. Number four, every patient has a story. Every patient is a puzzle, and the pieces don't just come together from their symptoms. They come from their story. What's happening at home? Are they caring for a sick parent? Are they working long hours to support their family? These details are so important because they affect how we treat them. I had a patient once who kept missing follow-up appointments. It wasn't because they did not care, it was because they could not get time off from work. And so when I understood their story, we worked out a plan that fit their schedule. Patients want to know that you see them, not just their disease. Number five, you don't have to know everything. I wish somebody had told me this earlier. It's okay not to have all the answers. And patients don't expect you to be perfect, but they do expect you to be honest. If you don't know, just say no. I usually say something like, "Oh, that's a great question, and I want to double check before giving you an answer." Patients appreciate when you're thorough, and it's way better than pretending to know something that you don't. Number six, focus on the patient, not just the numbers. As a kidney specialist, I often find myself laser focused on the kidney function and the lab numbers, the creatinine levels, the EGFR, and so on. But over the years, I've learned that I'm not just treating kidneys, I'm treating a whole person. A patient's kidney function doesn't exist in isolation. Other conditions like their diabetes or heart disease can affect the kidneys, and the kidneys in turn can impact other organs. So medication for one condition might worsen another. So it's really important to see the big picture. Yes, it's important to pay attention to the specifics of your specialty, but don't lose sight of the patient as a whole. They are not just a number on a lab report or a problem to solve. Treating them holistically is what leads to truly meaningful care. Number seven, communication is as important as the treatment. Patients need more than just treatment. they need to understand what's happening. Being transparent with about what you know and what you're still figuring out is really important. If you can't pinpoint the exact cause of your symptoms, explain what you have ruled out. For example, what I often say is, we know that this isn't X or Y, which is great news, but we're still working to uncover the exact cause. This kind of honesty reassures patients that you're thorough and invested in their care. It also helps reduce the anxiety because they can trust that you are addressing their concerns, even if all the answers aren't immediately clear. Number 8, time is the most valuable gift you can give. Patients know when you're rushing. Even if you spend just a couple of extra minutes with them, it makes a huge difference. I always try to sit down, look them in the eye, and really listen. Pro tip, sitting down changes the perception of time. Patients feel like you spend more time with them, even if it's the same 5 minutes. It's a small gesture, but it makes them feel valued and cared for. Number 9, mistakes happen. Own them. Let's be real, we are humans and we make mistakes. I've forgotten to order labs, I've missed a follow-up call, you name it. And the important thing is to own up to it. I usually say, that's my fault, I'm sorry, let me fix it right now. Patients don't accept perfection, but they do expect accountability. And honestly, admitting mistakes make you more trustworthy in their eyes. Number 10, not every patient wants the same thing. Patients have different priorities, and that's normal. Some want aggressive treatments, while others want to focus on quality of life. Even with lifestyle changes, you have to tailor your advice to the individual. For example, I've had patients with diabetes who want to quit sugar cold turkey, and then the others who want to cut back gradually. It's not about what you think is best, it's about what they're ready and willing to do. Number 11, teamwork saves lives. Remember, you're not in this alone. Nurses, techs, medical assistants, and the other specialties and doctors are your allies, and they bring so much to the table. I've learned to trust their insights because they often see things that I might miss. Medicine isn't about the smartest person in the room, it's about working together to give patient the best care possible. Number 12, let go of the savior complex. I used to think that it was my job to save every patient. But here's the truth. You're not the hero of their story. They are. Your role is to guide, coach, and support them, not to take full responsibility for their journey. The savior complex might come from a good place, but it can actually do more harm than good. It can strip patients of their autonomy, making them feel dependent or powerless in their own care. It also sets you up for burnout because of the weight of trying to fix everyone, because the weight of trying to fix everyone is unsustainable. And let's be real, it starts to get into our heads and we forget to become humble. Patients need to feel ownership over their health decisions. When you empower them to make choices, they're more likely to stick with the plan and see meaningful results. So instead of trying to save the day, focus on giving them the tools, knowledge, and confidence to be the hero of their own story. Number 13, your role is more than a healer. As a doctor, you wear many hats. Sometimes you're a counselor listening to a patient's fears. Other times you are an advocate, helping them navigate a complex health system. And sometimes you're simply there to reassure them during a crisis. Recognizing these roles make you a more compassionate and effective physician. Number 14, explain, educate, empower. Patients want to understand their conditions and treatment options. So make sure you give clear explanations and encourage their involvement in order to build long-term trust. Now, the point is not about dumbing down things for patients. That's not the right mindset. The goal is to explain a condition in a clear manner without medical jargon. If you do want to use medical jargon, make sure you explain the meaning of those words and give them time to process. They likely need more than a few times to understand that information. Number 15, don't forget about the caregiver. Caregivers are often overlooked, but they shoulder much of the burden. So pause, ask them how they're doing. When a patient passes away, caregivers or care partners can feel really lost and alone. And so following up with a simple call several weeks later can mean so much to them. It's these little gestures that show you care about the whole family, not just the patient. Number 16, stay curious and keep learning. Medicine is constantly evolving, and so staying curious keeps you at the top of your game. Read new research, attend conferences, and never stop asking questions. The more you learn, the better equipped you are to provide the best care for your patients. These are just a few of the lessons I've learned after 16 years of practicing medicine. Patient care is as much about listening and empathy as it is about treatment and diagnoses. So I hope these insights resonate with you and inspire you in your own journey, whether you are a doctor, a student, or someone simply curious about the art of medicine. I'll see you in the next video.